Hello, welcome everybody. It's a pleasure to have you today in this FIP webinar, introducing FIP Transforming Vaccination Globally, Regionally and Nationally 2021. We have very good speakers today, which I have the pleasure to be introduced. I'm sharing this webinar as a co-moderator with Carlos Lacava. Carlos Lacava is FIP president at FIP. He is also member of the Uruguayan Association of Chemistry and Pharmacy. Welcome, Carlos. Bienvenido, Carlos. Next, please. My name is Eduardo Savio. I'm the president of the Pharmaceutical Forum of the Americas. As you know, this webinar is being recorded and live streamed and via YouTube. The recording will be available on our site, events.fip.org. You may ask any question using the question box, which is provided, the Q&A box. You are welcome to provide feedback to webinars@fip.org. And welcome as member of FIP at www.fip.org membership registration. Well, these webinars will address FIP Transforming Vaccination Regionally and Globally 2020, which has started this series, and this name is Recapping Key Outcomes. The first FIP Digital Transformation Outcome based on live programs was underpinned by FIP development goals and results in global FIP commitment to action on vaccination and pharmacy and FIP transforming vaccination collections that is integrated and is available in our webpage, transformingvaccination.fip.org. This Transforming Vaccination series has been integrated by 12 events over 2 series. The series number 1 was towards equity in vaccinations globally, and series number 2, it addressed sustainability in vaccinations regionally and nationally. This series addressed 3 development goals. Previous one, the development goals number 10 that address equity and equality, the development goal number 18, and development goal number 21, which address sustainability in pharmacy. The series number 1 was towards equity in vaccination globally. The first of these 2 series comprised 5 episodes, which include the opening event alongside 4 other events, which explore equity in vaccinations across the different angles of age, gender, literacy and education, collaborations, and working together. Series number 2 was address sustainability in vaccination regionally and nationally. And the second series comprised 7 digital events, including 6 regional roundtables, which will discuss and identify priorities for sustainable access to vaccination through pharmacies around the world. The program will end with a leadership summit in which we present a commitment to action on sustainable and equitable access to vaccine through pharmacies. The key outcomes of Transforming Vaccinations 2021 are 12 digital events, including 6 regional roundtables and a leadership summit, FIP global commitment to accelerate equity, access, and sustainability of vaccinations, and special policy collection. We are very pleased to introduce today's panelists, Martha Rebour, Magali Rodriguez de Bidner, Casey Thompson, who will be introduced by my colleague, Carlos Lacava. Next, please. Take the floor, please, Carlos.
Thank you, Eduardo. Hello, everybody. Our first speaker will be Martha Rebour. She is Executive Director of Shot Alive campaign from United Nations Foundation. She works there since June 2014. Please, Martha. You can start.
Yes, hi, good morning, good afternoon to everyone. I am thrilled to be here. And really, thank you all so much for your interest in vaccine equity. I will be taking you through a little bit what is Shot at Life, and then a little bit about the global plan to ensure vaccine equity. Shot at Life stands for vaccine equity. And thankfully, with our partners at WHO and UNICEF, there is now a roadmap. So to start you on what is Shot at Life, we are a campaign of the UN Foundation. And the United Nations Foundation, I should be clear, is a nonprofit organization that is not officially part of the UN, but in order to use the UN's name, we have a special relationship with the UN. So the UN Foundation was started about 22 years ago when Ted Turner of CNN fame made $1 billion pledge to the UN to support the work of the UN. And Shot at Life was founded about 10 years ago, and we fall under the global health pillar of the UN Foundation. And Shot at Life was founded for a very specific purpose. The purpose was building US champions for global immunization. So in fact, it was the Gates Foundation that recognized that policymakers in the US need to hear from their constituents about vaccines, what a great and relatively inexpensive investment they are that have large impact. So they provided some seed investment to start Shot at Life. And we are a grassroots advocacy organization. We train people and people from all walks of life. Some are pharmacists, some are pharmacy students, some are simply citizens who are passionate about this issue. We train them on how to become advocates for children around the world and how to encourage robust US funding for immunization programs. And if we could move on, I will say vaccine equity is really at the center of what we do, and it's now more important than ever. So we all know during this pandemic, we have not only seen the incredible value of vaccines to get us out of the pandemic, but what I think is important to know is that global immunization rates have plummeted, and anybody who works in healthcare won't be surprised by this. We saw this happen a little bit on a much smaller scale, obviously, when there was the Ebola outbreak in Western Africa. People are hesitant to visit health clinics because they don't want to pick up the virus. Parents are worried keeping their children at home. And then we know health systems have just buckled under the incredible strain from this pandemic. So I think this pandemic really, it's important to underline, it has reminded the world of the power of vaccines to fight disease, save lives, and create a healthier, safer, and more prosperous future. We must rapidly and equitably deliver the COVID-19 vaccines to the world. But I think moving forward, there needs to be a recognition we need strong immunization systems, and we need the infrastructure so that people everywhere are protected against COVID and other diseases, other infectious diseases. And ensuring that everyone receives the vaccines they need will help provide an exceptional return on investment and keep the world safe from future pandemics. So we know, for instance, that between 2019 and 2020, 3.5 additional children were under-vaccinated. So we went from 20 million now to 23 million children who are under-vaccinated.
This is putting us in a dangerous situation for outbreaks, and it's really important that the world comes together now. And as I said, not only fights the pandemic, but make sure that we don't leave children and routine immunization behind. We need to continue to inform and educate around the safety and efficacy of vaccines. A lot of misinformation has crept in. We need to tell the stories of what vaccines make possible and use trusted community leaders and influencers to help amplify these messages and share these stories. So drawing on the lessons learned, IA 2030, Immunization Agenda 2030, is a collective endeavor by all stakeholders to achieve a world where everyone, everywhere, at every age, fully benefits from vaccines to improve health and well-being. So some of the specific goals of IA 2030, and this is something that I think is so important about this roadmap, is there are real specific goals and targets. So eradication of polio and measles and rubella by 2030. This is a plan for 2021 to 2030. Elimination of tetanus and control of Japanese encephalitis. So the World Health Organization, many of you may have seen just yesterday, did another launch of the specific strategy to eliminate meningitis by 2030. And this roadmap prioritizes high immunization coverage, development of new affordable vaccines, and improved prevention strategies and outbreak response. It's really important that when you look at a full strategy around immunization, as you all know, it's critically important you also think about outbreak response, surveillance, diagnosis, and then optimal treatment when people do get sick. So some other very ambitious goals, and I think something that's really important to talk about, is zero-dose children. If I could have the next slide, please. Thank you. So there are 14 million children around the world who do not receive one single vaccine. We call these the zero-dose children. We have to change this. Not only on a humanitarian level, is that simply wrong? We also all know infectious disease, we need to get coverage in order to keep diseases under control. So Immunization Agenda 2030 is looking to cut that number in half, so cut by 50%, which is a very ambitious challenge, but one that is reachable. And as I said, the great thing about this roadmap is there are specific targets. There's also a great goal of, we know vaccine introductions, new vaccine introductions are vitally important. And the goal within IA 2030 is for 500 vaccine introductions by the end of the decade. Again, an ambitious goal, but something that we can reach. So how do we achieve global vaccine equity? I think we know it's really important to have a strong system and a strong infrastructure. And we need to make sure there is health-seeking behavior around vaccines for all ages. So I've talked a lot about children, and traditionally Shot at Life has been very focused on routine immunization and immunizing children. But in line with IA 2030, we are increasing our scope to make sure that we are educating, informing, and advocating around vaccines for all ages. And IA 2030 is very clear on that too. There are vaccines for teens and for adults, and we must make sure that we're informing and protecting people at all ages. So what are the barriers to achieving vaccine equity? So on the global level, nationalism hinders sometimes multilateral efforts. So, you know, the human instinct sometimes is to take care of one's own first. So there needs to be structures put in place so regions and countries can become more self-reliant. We've seen through this pandemic that nationalism really has hindered being able to protect all people and provide equitable access to the COVID vaccine. Another barrier is weak country health and immunization infrastructure and systems. And I talked about this. This can mean everything from health workforce shortages to the supply chain breaking down. But it's really important that each country really works on strengthening their infrastructure, not only to respond to this pandemic, but to serve them in the future against other disease prevention. Vaccine manufacturing is a for-profit business, and there are a lot of very positive things about that. But I think it's also up to the global health community to talk about the humanitarian objective and vaccines as a public good, particularly while we're in the middle of a global pandemic. And I think we've seen a lot of vaccine manufacturers really come through on donations and on making their vaccines available around the world. We need to see more of this. Another barrier is the lack of manufacturing facilities and resources in each country and region. Brazil has incredible manufacturing, as does India, but as both of those countries were hit so hard by the pandemic, they weren't able to provide the manufacturing capacity enough to really meet the needs. So I think it's important to continue to spread out manufacturing facilities. And then, of course, there's misinformation around vaccines. The Rockefeller Foundation had a great quote. They said, the COVID-19 pandemic is laying bare a hard truth. Facts alone are not sufficient to drive behavior change during a crisis. Misinformation that plays on emotion is. And we've seen that with a lot of emotional stories and falsehoods around side effects from the vaccine. So a recent study in the peer-reviewed journal Nature found that even a brief exposure to misinformation would make people less likely to want a COVID vaccine, which is, we know, the most effective tool to stopping this pandemic. So we need to make sure that we are also providing stories along with information. But as they were saying, facts alone are not enough. We need to provide positive stories about the difference that vaccines have made in people's lives. And I feel like there's been a vacuum, and it's really a role for all of us to fill in, because in that vacuum, a lot of misinformation has gotten out and has had very detrimental effects. So for the policy changes that will increase vaccine equity from a policy point of view, it's really important that immunization programs are part of primary health care and that we work towards universal health coverage. We must ensure that sustainable immunization programs are an integral part of the national primary healthcare strategies and operations. There needs to be good leadership, government, and management. So where there's effective coordination, financial management, and performance monitoring of the immunization programs. And then, of course, the health workforce. This is a challenge in many regions and many countries. There needs to be appropriate distribution of healthcare workers who are motivated, skilled, knowledgeable, and regularly trained and compensated. So we find that in a lot of countries, healthcare workers are not evenly spread out and tend to be more densely distributed in urban areas. So we need to make sure that there are incentives to spread out healthcare workers and they get regular good training and compensation. And then supply chain and logistics, it's important to strengthen supply chains to ensure that high quality vaccines are always available in the right quantity and form at the right time, in the right place, and stored and distributed under the right conditions. Of course, this is all very challenging, but putting these systems in place, and a lot of them are starting to be put in place for the pandemic, will serve well for future vaccines. And then it's important to promote integration with other supply chains for more effective delivery. So sometimes there are already effective supply chains in place through the private sector or other areas, and it's important to look and see where collaboration and cooperation could pay off. And then, of course, it's also important to safely manage, treat, and dispose of vaccine waste so that we're reducing the environmental footprint. And then surveillance is another key part of a strong immunization system. So we need to increase the efficiency, responsiveness, and comprehensiveness of disease surveillance in order to encourage the introduction of vaccines, optimize the programs, measure the impact, monitor disease control, elimination, and eradication, and detect, investigate, and respond to outbreaks. We all know that without a good surveillance system, you do not have a strong immunization system. So that's my presentation. I'd like to just say that I've presented a lot on IA 2030, which is run out of WHO and UNICEF. Shot at Life's specific work is informing US policymakers about this and really pushing them to have robust funding. So our work is done mostly in the US on behalf of children and people living in the lowest income countries. So thank you again for the opportunity to present, and I'd like to move on to, I think Magali is the next presenter.
Your microphone, Carlos.
Thank you, Martha. Now we are going to move to our next speaker, Magali Rodriguez de Widner. Dr. Rodriguez de Widner is a professor, is Associated Dean for Clinical Service and Practice Transformation and Executive Director of the Center of Innovative Pharmacy Solutions at the University of Maryland School of Pharmacy. She's a member of the American Pharmacists Association Board of Trustees and Vice President of the Pharmaceutical Forum of America. We hear you, Magali.
All right, well, thank you, Carlos, for the introduction, and thank you to FIP for asking me to share with you some of the information about vaccination, vaccine confidence, and what's happening in the United States with our pharmacists. And it's a pleasure for me, again, on behalf of APHA, the American Pharmacists Association, and the Pharmaceutical Forum of the America to be with you. So I wanted to start by level setting a little bit, and this should be no news to any of you in this particular webinar, but I wanted to level set the critical role that pharmacists have as part of the healthcare system in really providing medication, therapeutics, vaccine, and what a critical role we play in the health services, particularly in public health. And I think there has been no year like this year and a half, almost 2 years, with the COVID crisis to really highlight how critical pharmacists are in really promoting public health and coming to the forefront. One of the things that, the motto that we're using is pharmacists are COVID heroes. In the United States, when many physician practices closed, community pharmacies stay open, and patients had only the pharmacists as these healthcare providers really assisting them to navigate the pandemic. With that, I wanted to start then talking a little bit about what are happening in the United States as it relates to strength and priorities, and looking at what are those issues regarding vaccine equity, access, and sustainability. So one of the things that I think is important for me to remind everybody is that pharmacists have been willing, ready, and able to assume this vaccination role long before COVID-19. in the United States, we've been lucky enough that pharmacists have been trained. There is a training program that was developed many, many years ago by the American Pharmacists Associations, where it prepared pharmacists to be able to administer medications from the community pharmacy and other settings, healthcare systems and other places. So one of the things that happens with that training is that many of our schools of pharmacy have integrated that certificate program within the educational programs of the school. So we have about 400,000 pharmacists and student pharmacists in the United States that have this training. And as such, in many of the states, by legislation, once you have this certificate program, you could register to be an immunized in that particular state. This year, we're starting to see also an increase in the pharmacy technicians that are being trained to provide immunizations. So this year, particularly in the last year and a half, about 100,000 pharmacy technicians have been trained to administer these vaccines to assist the pharmacists across the lifespan, and like I stated, across practice sites. So more than 40,000 pharmacies across the United States in health system, long-term facilities are providing these vaccinations. And one of the key things for us has been highlighting the power that pharmacists have, since 90% of the US population lives within 5 miles of a community pharmacy. So again, access. When we talk about accessibility, there's not a better place than a community pharmacy to be able to provide that access. When we talk about equity, one of the key things here is highlighting also the fact that many of these community pharmacies are within the neighborhoods where we have underserved patients that now have the confidence that they have a pharmacy they can go to. They have a healthcare provider that understands the community, understands what's going on, already has a relationship with that patient. So we found that particularly during this COVID-19 pandemic, that relationship that patients have with the pharmacists, the community pharmacy, was critical in overcoming not the issues of access, but the issue of equity, and really has played a tremendous role as we talked about increasing confidence in our patients that these vaccines are in fact safe and will be something that helps them. One of the concepts that I wanted to kind of introduce is what is called the Immunization Neighborhood. And this has been a concept that APHA, the American Pharmacists Association, has been promoting since 2012. And the concept here is that we can create this neighborhood, this network that emphasizes 3 main things. One is collaboration, one is coordination, and one is communication. So the idea here is that all these stakeholders that are engaged in some manner in the issue of immunization and vaccinations really come together to provide a collaboration, coordination, and communication so we meet the needs of our patients as it relates to immunizations. One of the things that I wanted to make sure we understand when I talk about this, I'm not just talking about COVID-19, but really I'm talking about the lifespan of vaccinations, all the way from children to older adults. We're talking about vaccines like the flu, hepatitis A, hepatitis B, hepatitis C. We're talking about, shingles. We're talking about childhood immunization. So again, is the ability for all of these different stakeholders to come together in a patient and community-centric way, and really investing in assessing, administering, and referring patients to the appropriate vaccinations, but do it in a coordinated way where this information can be shared. One of the things that we have successfully, I think, implemented in the United States is what is called an immunization registry that is electronic. And so through that immunization registry, individuals that get vaccines in pharmacies, this gets recorded in the, some of us call it ImmuNet, which is this ability for us to record electronically which vaccines the patients got, what is the dose. And so in that way, that information is accessible to any other provider that is seeing that patient. So we avoid the duplication of vaccines and also increase the communication across the different stakeholders. So particularly with this whole issue of making a difference and the whole issue of COVID vaccine. Next slide. One of the things that we have been working very diligently is really on a couple of things. One is, providing resources to our pharmacists and to the community as it relates to vaccinations, and particularly with the COVID-19. One of the things that you heard Martha said is that how important it is to dispel misinformation. So misinformation is critical to dispel. So one of the things that we want to make sure is that we're able to dispel any misinformation that these patients have and provide the appropriate information, particularly for our pharmacists. Pharmacists, particularly during COVID-19, were in a great need to have access to reliable evidence-based vaccine. So one of the things that we have done, and I encourage you to please visit this link that I provided here for you, is really a series of information, but also in a very graphical way that is accessible to patients too, talking about experiences increasing confidence to vaccines for patients. So we're highlighting a variety of pharmacists and healthcare personnel in different neighborhoods and in different settings to again increase the ability of individuals to understand the role of the pharmacist in vaccination, but to understand the safety and importance that vaccine do have for diseases. So the next slide, please. So one of the things that we have done that we're very proud of, the American Pharmacists Association, is really enter into a collaboration with the Center for Disease Control, with the CDC. And so we have received funding to develop this co-project with a CDC, where the focus of the project is to provide support, education, resources, and information that lead to three main outcomes. One of the first outcomes is vaccine confidence for pharmacists. So we have developed videos, information, tools that actually provide the pharmacists with the confidence of being in the front line to be an effective immunizer. We also have developed tools for patients to really increase the confidence of patients, provide the necessary information for them related to vaccines, their power of vaccines, the effects of vaccines, and particularly focusing a lot in the misinformation that patients are getting related to COVID vaccine, and talking about developing confidence in communities. So I also encourage you to visit this website because it's very powerful. Not only have we produced these videos with real patients and real pharmacists that are right in the front line in their neighborhoods, but we have been able to do it in a variety of languages and really assuring that these messages are culturally sound and culturally appropriate, and really highlights these communities and speak to the core of their belief system. I have had the honor to be part of this particular project. And as you see here in one of the pictures, one of the communities that I have been working with is the Hispanic community in the United States, which again is one of the highest risk because of their where they work, because of their probably lack of resources at time, but really bringing the message that pharmacists are accessible to them, bringing the message again of feeling confident about the COVID vaccine and to get immunized and to make sure that they achieve these resources. So we also, besides these, one of the things that we wanted to talk about was a little bit about weaknesses and challenges. So besides these successful story in the United States, we also know that there are some areas in which we need to really emphasize. So one of the things that we know is how critical it is for us to continue to work with the different legislative units, to work with the different states, to make sure that authority to vaccinate stays after COVID-19, but also to expand some of the authority of vaccination in different states. One of the things that makes it a little bit challenging in the United States is that each state gets to do their own regulations. So it may be that in one state, pharmacists have the ability to do certain things, for example, immunize or provide childhood immunizations. In other states, it may only be adolescents and adults. In some states, there's restrictions that can only be the flu and pneumonia vaccine. In other states, it's very broad. So again, one of our goals and one of our challenges is to continue to expand this authority to vaccinate, to overcome some of these restrictions and try to make it more uniform across the whole United States and not be so state specific. So again, making sure that it's not only the COVID-19 vaccine, but childhood, adolescent, and adult. We have data that have shown how critical pharmacists have been in making sure that children get their vaccinations prior to starting school. We also want to make sure that there is adequate reimbursement for pharmacist services. And what I mean by that is that pharmacists that are administering these vaccines have access and they have the same level of payment, not only by public, but also by private payers related to the administration of the vaccine. So there's equity with other providers across the healthcare system. And that has been an area, I think, of great satisfaction for us for many years has been that under the Medicare system in the United States, one of the things that has happened is that pharmacists can provide immunization to older adults. And within Medicare, the reimbursement to pharmacists doing the services have been equal to any other provider within the healthcare system. So there have been parity and equity there. So we want to make sure that that persists and it expands to all other vaccines and it expands to private and public payers. We also want to make sure that we continue to be recognized by different federal agencies, government agencies, CDC, as frontline providers. And what I mean by that is that that designation of being frontline providers will assure that in any other pandemic, any other crises, we have adequate equipment, we have adequate PPE, that the workplace conditions and protections that are for frontline workers extend to pharmacists, and that we have the adequate staffing support to provide these vaccinations. One of the challenges that we're starting to see in community pharmacies now is that when, with all of this resurgence of the COVID vaccine, also now we're entering the United States in the flu season. One of the things that we're seeing is that pharmacists and community pharmacists are overwhelmed by the number of individuals that require these vaccinations, and those are done on demand. What that means is that anybody can walk into any pharmacy in the United States at any time without an appointment and receive the vaccination. So this has created an increase in workload. So we want to make sure that they have adequate support staff. and clarity and consistency in policies, procedures, and communication. So we have more uniformity, like I stated, among the United States. Pharmacies also are essential vaccine access points and trusted immunization providers, and we want to be recognized as such in any type of legislation and any kind of statement, not only for the distribution, but also as key players in vaccine confidence, in access, in equity, and information. So again, these are kind of the biggest things that we are working on and that are challenging. So that moves us to thinking about what is one policy change that can take place today within the region that can increase access to vaccination and assure that there's equity in vaccination and access for our patients. So one of the things that we're working very diligently is in assuring that during the pandemic in the United States, there was something that was called the PrEP Act. And what that means is that during that particular legislative mandate, a lot of the regulations were put on hold. And there were some concessions that were made to allow pharmacists to engage more broadly in vaccination. So we want to make sure that that continues. We actually have APHA is leading a bill in the Congress to make sure that these concessions stay, but also that we can expand to other vaccinations, and also that pharmacists may be able to order these vaccines. So sometimes we require a primary care provider to order them. So we're trying to make sure that we expand it where the pharmacists can initiate the testing, they can initiate the vaccines without an order. And again, making sure that we recognize by public and private entities and programs and health plans as individuals that have the ability, the willingness, the training to provide these vaccinations, and removing some of the access barriers. One of the things in our system is that we want to make sure that not having a health plan or a prescription plan does not prevent a patient from receiving the vaccinations that they require, and that there's no out-of-pocket expenses, so patients can have access and we're able to meet the public health needs of our patients. So again, in summary, we had very short time, but I wanted to provide you with kind of the story of the pharmacist, how in the United States, this COVID-19 has helped to really, it's a great opportunity for us to come to the forefront and be recognized as public health workers, be recognized as, again, COVID-19 heroes as we are. And I thank you again for your attention.
Thank you, Magali. Wonderful, your presentation. Now, we are going to move to our third speaker, Dr. Casey Thompson. Dr. Thompson is Chief Operating Officer and Senior Vice President of the American Society of Health System Pharmacists. Well, Dr. Thompson, go ahead. Thank you.
Thank you very much, Carlos, and greetings, everyone. It's been a real honor and pleasure to see all the names appear in the chat and the representation of everyone from around the globe. It's a true honor for me to be here with you today and with my esteemed colleagues on the panel, most of whom I've had an opportunity to work with extensively over the years, and I have very deep respect and admiration for. I had the honor last year of being on a panel in September 2020 for FIP that a friend and colleague of mine and many of yours, Toyin Tafade, was one of the organizers and moderators of to talk about pharmacy's response to the pandemic. And at that time, we were anticipating the availability of vaccines. One of the questions that I think we were all asked, and I may have answered early on, was what do you think the challenges will be? And one of my immediate responses was global equity and access to the vaccines once they were available. It's very saddening to see the fact that many people around the world and in many countries who want to get a dose of the vaccine have absolutely no access. I think that was easy to anticipate that it would happen, but nonetheless, ethically, morally, and just very sad that has occurred the way it has. I don't mean to start on a down note, but I think if you would have asked me 10, maybe even 20 years ago, as I was working on emergency preparedness and response issues, including pandemic planning response, if you would have asked me the same question 2 decades ago, I would have said global equity would have been a challenge to access to a therapeutic such as a vaccine. So here we are today to discuss that and many other efforts. You've had an opportunity to read about the organization that I've had the pleasure of working with for 22 years now, ASHP, that represents over 58,000 pharmacists that work in hospitals and health systems across the continuum of care in the US, and collaborates with all the organizations that are speaking today. So my objectives for our discussion is to describe the U.S. pharmacy workforce response to COVID-19, that some of which my friend and colleague Magali just spoke about, but I'll reinforce some and provide some additional perspectives. Identify some strengths and priorities of vaccine equity and access and sustainability based on what we've learned heretofore from the rollout of the vaccinations. Recognize vaccine challenges met by the healthcare and pharmacy workforce. I've already given you a preview of my views on the global challenges, and I'll talk about some of those that we've had in the US as well, but just please know that I fully recognize that the challenges are much greater in many places around the world than what we've had here, where we have an abundant supply of vaccine, and unfortunately many people who do not want to receive it, even though it's available. It's quite sad. And to discuss recent recommendations and advocacy efforts that we and others have been engaged in. So we'll kind of frame this around the pharmacy workforce as part of the overall healthcare team. And as has been noticed, pharmacists have been heroes and have really provided key points of access, leadership, and direct patient care during this horrible pandemic. I have to recognize all of our friends and colleagues in medicine, nursing, respiratory therapy, and so many others as well that have also served in those front lines. Some have given their lives to serve their patients throughout this pandemic. Well, you know, this provides some imagery of actual pictures of pharmacists in this country that have been involved in the global pandemic and the work that they've done throughout that. I think many of these images display mass vaccination efforts in the US. And if we had the images, we could show the pharmacist in gowns and N95 masks and intensive care units as well, along with nurses, physicians, respiratory therapists, and many others dealing with patients that were facing very dire situations in those settings, as well as clinics. This provides a overview of the supply chain, and I would say the areas that we've had to focus on, you know, obviously from the vaccine development stage. And, you know, I have to give the pharmaceutical industry, Pfizer, Moderna, Johnson & Johnson, AstraZeneca, and many others, a lot of credit for the efforts that they made to bring these to market, along with the governments that helped fund a lot of those. But really quite a impressive effort in the period of time to develop these vaccines. And then looking at the distribution, the allocation of the vaccine, the mass vaccination efforts in the US, attempting to get to as many of the 330 million people that we have in this country, clearly the ones that are eligible, not all in that number I cited would have been. The monitoring, you know, having approved these vaccines through our US Food and Drug Administration under emergency use authorizations, clearly good science was adhered to and studies were done, and clinical trials, but monitoring for what we knew were going to be adverse effects that we couldn't anticipate, and trying to learn and understand from those for future development and patient care and the overall surveillance as well, of course. ASHP, I spoke about this last year on the panel again that I had a pleasure to be part of with FIP. We issued a set of principles that our board of directors approved on August 20th of 2020 last year to kind of describe what we thought were important points that anybody needed to think about. And I think we were targeting government and efforts to mass immunize the US population, but also the global population as well. I won't read through each of these. They're available here. They're available for free on our website if you'd like to look at them and reflect on them. Each one of these has about a paragraph description under it if you are interested in reading and learning more about kind of the underlying principles that guide these 10 points that are on this slide. So let's talk a bit now in the next set of slides about national strengths and priorities around vaccines. In the area of vaccine advocacy, I wouldn't limit this to what I've described here as access, affordability, and convenience, but I think that some of the points I've made here are definitely focused on those, but there's definitely other categories as well. We work to advance critical support for mass administration of vaccines. Again, when you're looking at a population of 330 million people, that's a major undertaking. And again, in the US, we're very fortunate to have had the resources for our government to help facilitate the manufacturing of these vaccines, the research around it, and then ultimately the ability to vaccinate the entire US population. Broader authorizations for pharmacists, pharmacy technicians to order and administer vaccines. Pharmacy students played a huge role in that as well, not just pharmacists and pharmacy technicians. As my colleague, Dr. Bittner mentioned, payment for vaccine administration to help facilitate that. Priority immunization for pharmacists and technicians and all healthcare professionals, but we clearly wanted to make sure that, as pharmacists, pharmacy students, and technicians serving on the front lines, that they were in that first tier in the US for receiving the vaccine, since they were exposed in clinics, community pharmacies, and ICUs to patients infected with COVID, and a transparent and robust vaccine approval and authorization process. Our US FDA and the equivalents around the world did heroic and amazing things that I think we'll talk about for a long time and learn from. But you can imagine, as we all had, wondering, what was happening, when we were going to see, the availability of the vaccines, and ensuring that there was a level of transparency, around that entire process. ASHP very early on, I would say in March 2020, made a strategic decision. I would say it was a public health moral decision to provide as many resources that we could, new and current, not just to the US population, but to the entire world. So we looked at everything that we had current, and we looked at everything that we were going to develop, and made a decision to make it free to the world, to help in every way we can. I think we've, if we added it up, we haven't taken the time to do that. We've invested millions of dollars, US dollars, to do everything we could. We have an open access COVID-19 resource center that I hope many of you have access. We've looked at the data, and frankly, the global access has been very high. We made accessible our critical care Board of Pharmacy Specialty certification resources that are used for pharmacists that are seeking advanced certification in critical care, that we charge thousands of dollars for. But we made that free because we knew that a lot of people, healthcare providers, were going to need to understand, advanced principles in critical care, because there weren't enough critical care physicians, nurses, pharmacists, the whole range of people that specialize in that area. And we had, I think, as of many months ago, I actually should have looked before this presentation, over 50,000 downloads, many of those from outside the United States, which is exactly what we were hoping for. We've done webinars, over 60 as of this presentation, from subject matter experts, from government, industry, and practice. And again, have made those free to everyone around the world, in the United States as well. We have a webpage that's dedicated specifically to vaccines. Because we're a developer of evidence-based drug information through our American Hospital Formulary Service, it's called AHFS. We early on created a process to develop drug information focused on COVID drugs. You know, in the beginning, it was drugs like remdesivir and remdesivir and monoclonal antibodies, and then of course all the drugs that are used, neuromuscular blockers, analgesics, and others, and now the vaccines, and made that freely available, and received a lot of input from around the world and from outside pharmacy. You know, that this was the resource that was utilized and appreciated, which is why we developed it, not for the appreciation, but to really advance patient care and be helpful in this area. And, you know, we've worked very hard to highlight the heroic stories of pharmacists throughout this pandemic, and that they have been. It's very touching and heart-wrenching in many cases to see what all of our pharmacy students and technicians have done throughout the pandemic. We have a consumer face as well, and again, we don't charge anything for this. We spend a lot of money on it, but we quickly updated our consumer website and have continued to develop new resources and bring new and existing resources as well to consumers to help provide credible information for them to draw from, because unfortunately there's a lot of very bad information out there, sadly, that's being put out, you know, around the pandemic, and namely the safety and efficacy of the vaccines. And we're doing our part along with everybody here to dispel that. So some challenges and lessons learned that I'll reflect on for a few minutes before we conclude. Some of the weaknesses and challenges, vaccine storage, handling, and administration. Like all of you, we had to learn as we went. You know, as these vaccines were developed, we learned very early that these vaccines would have to be stored at very low temperatures, less than what most of our hospitals had the capabilities for, but quickly, you know, pivoted and purchased -80 freezers, freezer trucks, and everything else, so all the supplies, the syringes and everything. You know, we had to kind of learn quickly how to manage that. Changing information and recommendations, and it's easy to criticize, you know, and say, well, you know, our Centers for Disease Control and Prevention, our public health leaders and officials, you know, seem to change their minds a lot, and maybe there's some criticism there to be directed, but you know, in the middle of a crisis where every day, every minute, every hour sometimes is a new development. You know, we had to all, as practitioners, you know, move quickly and change direction based on, you know, what our public health officials were providing to us. Combating the trust in misinformation, or instilling trust in dealing with misinformation has to me been one of the more painful things to have had to have done. I would like to have said that I could have seen this coming in terms of the, you know, what we're seeing here in the U.S. around misinformation about the vaccines. That's causing a lot of patient harm and death, unfortunately, in children and older adults and our entire population. But it's just heart-wrenching to see. We've had to deal with medication shortages in the U.S. We have plenty of vaccine, but you know, during the critical stages of the pandemic, which we're in now, drugs such as neuromuscular blockers, analgesics like fentanyl became difficult to come by because they were being used at levels that were beyond what we were using them before, obviously, within our systems. The payment mechanisms have been mentioned. I won't go into those. Reaching small and rural communities and underserved communities in the United States. Many of you listening today have been to the United States and have flown over our country in an airplane. If you look down as you pass New York City and fly over that, it's a very vast area with a lot of rural and underserved areas in the country. We have large population centers, obviously, but a lot of areas that are more far reachable and harder to get to within the U.S. I won't go through this in detail. It's free on our website. I think it's a great resource among many others out there. We have a COVID vaccine confidence toolkit that we've developed to help prepare, promote, and provide and partner around ways to instill vaccine confidence to get as many people vaccinated as possible. You're free to use this as you can to adapt it to your communities and countries in any way you want to. It's available on our website, open access. We, along with others, APHA was a contributor to this as well, and several others helped produce a documentary that's really wonderful. It started out as one that was focused more broadly on the importance of vaccination before COVID happened, and then the producers of it quickly pivoted and included a focus on COVID. It's very, very well done. It's on our website. It's easily searchable. I think if you click on the slide, if you have access to it electronically, you can go to it as well. But it's well worth watching and quite well done. So looking ahead before I conclude, developments in our country from the Biden administration, we've moved in this country to mandating vaccines in all the places that the federal government has the authorities to do that. So all employers with 100 plus employees, all federal workers, all healthcare workers at Medicare and Medicaid participating hospitals. Those are our, I guess, for lack of a better term, federal insurance for retirees and those with disabilities, and the underserved entertainment venues that to require proof of vaccination. And we at ASHP, and I suspect many others in the Pharmacy Association community have required our employees to be vaccinated in order to maintain employment at ASHP, with the exception of religious and medically indicated reasons. And then, pharmacist authorization to order and administer COVID therapeutics under a law that was passed that gave the Secretary of our Health and Human Services authorities to, change some of the laws and change some of the regulations to facilitate more rapid access. So pharmacists now can administer subcutaneously monoclonal antibodies and any new therapeutics that may evolve in the future. And there's a lot of research and development that the pharmaceutical industry is doing now. So a lot of credit to the government for doing that and positioning pharmacists. And we'll all be working together in the US to make those authorities permanent, because there's many other areas in chronic diseases and others beyond the pandemic that pharmacists can do very important things for patients at the point of care in community pharmacies, hospital systems, and others. This is another effort that we were part of, and I won't go through this because I know we're probably running short on time, but this is a toolkit that was developed through an effort that ASHP is part of, building vaccine confidence in the healthcare neighborhood. Very robust and helpful document. Our chief executive officer, Dr. Paul Abramowitz, who many of you know, was one of the co-chairs of this, along with Dr. Georges Benjamin, the chief executive officer of the American Public Health Association. But I'll let you peruse this as you would like later. This kind of describes the pillars from the vaccine confidence in healthcare neighborhood. It looks at the diversity of people and perspectives, looks at inclusion, power, voice, culture, and then equity from a policy and practice position. Those are just kind of the themes from which the toolkit is based around. So building vaccine confidence, again, considerations for future vaccine development and approval are included in that tool. improving vaccine data and infrastructure, and broadening childhood and adult vaccine use and uptake. Again, we're learning a lot through this pandemic, and looking at future development, looking at how we better capture and use data, and how we focus more broadly COVID and beyond on childhood and adult vaccine use now and in the future. I mentioned earlier, our very close colleagues in nursing and medicine. We've endorsed and supported efforts from the American Medical Association. This is an example of something that we supported through the American Nurses Association related to COVID facts for nurses, and in the campaign that they had to support the nursing workforce around COVID-19 vaccination. And that concludes my discussion. Thank you so much, everybody, for being here. And again, it's a pleasure and honor for me to have had this opportunity, and I'll be prepared to answer any questions when we get to that point. Thank you.
Eduardo, I see that Sophia could join us. So her technical issue is resolved. Can you please invite her to the floor?
Yes, I don't know if you hear me.
Okay, welcome, Sophia. Carlos, thank you very much, Mila. Carlos will introduce Sophia. Please, Carlos, go ahead.
Yes. Professor Sofia Segura is professor from the University of Costa Rica and of the College of Pharmacists of Costa Rica. You have some minutes already. Thank you, Sophia.
Thank you very much, Carlos. And I am really sorry for the inconvenience that I had, but I'm truly happy to share this presentation with you. Okay, I'm going to wait a little. Okay. Thank you very much for this opportunity. I am very, very honored to share this conference with you, with all of you. And in this slide, there is a primary question we should ask, and I am talking about America in general. Can we speak in a general way about America? The answer is short, but actually it is complex. The answer is no. America is highly heterogeneous in terms of the composition of its population, politics, incomes, health systems, and access to vaccines. Because of this, the access to health and therefore immunization coverage is different from country to country. In the next slide, it is important to note that this heterogeneity existed previous to COVID-19 and has been exacerbated by the pandemic. Since 1974, the Pan American Health Organization has been developing the expanded immunization program through a strategy that was allowed the immunization of the Latin American population against diseases like tuberculosis, polio, diphtheria, pertussis, tetanus, and measles. Also, there are social, cultural, and economic differences that determine access. Because of this, it is of huge importance, this expanded program of immunization. Also, the costs invested in health are different from country to country, and the composition of the health systems is also different. It is characterized, Latin America especially, is characterized by an important informal sector, which does not always have access to health services. And this is really, really important in terms of vaccination, because when we are talking about vaccination, we are talking about a collective strategy. And finally, regarding before COVID-19, I have to say that there are vulnerable and neglected populations within Latin America in terms of health. For example, indigenous communities, homeless people, people living in poverty and extreme poverty, informal caregivers, among others. So what happened after COVID-19? The scenario got worse with the arrival of the pandemic. The expanded immunization program had to continue, while measures to contain the pandemic had to be developed in a context where the research, development, distribution, and administration of vaccines against COVID-19 is imperative. All of this has implied an exacerbation of the inequality, which conditions the response to the pandemic in the current context. Next, please. Okay. In this slide, we see the scenario of some indicators of the expanded immunization program developed by the Pan American Health Organization. Data for the year 2019 are presented for all the countries of North, South, and Latin America and the Caribbean. This figure shows that for some cases, vaccination coverage is low. On the left side, you can see the average for the entire region, and the minimum and maximum coverage are shown in parentheses. As you can see, it is important to highlight the coverage for Venezuela in terms of measles, mumps, and rubella, the 2 doses. It is 13%, as well as the situation of some countries, such as Jamaica and Haiti in relation with a pneumococcal vaccine. They have a very low coverage, the 3 doses of pneumococcal vaccine. However, I have to say that in general, the percentages are quite high and show the success of the program. In the next slide, please. Okay. This is a conclusion about the extended immunization program, and says that with the implementation of the extended immunization program, vaccination coverage in the Americas increased from levels to 25 to 30% during the first part of the 70s to coverage close to 60% in the early 80s and more than 90% in the early 21st century. This has meant a great achievement in disease prevention, a great achievement in public health, and an important milestone, especially for Latin America. Next, please. Okay. Recently, all these actions carried by the Pan American Health Organization are included in the Regional Immunization Action Plan 2015-2020. And it has the vision to ensure universal access to vaccines, face increasing pressure from the so-called anti-vaccine groups, address the high cost of new vaccines, which is a barrier of equitable access, keep immunization as a high political priority. This is of quite importance, and one of the things that we have to take into account when we are working in health, reflected in the sustained allocation of national resources, and manage the growing number of partners interested in immunization, which requires coordination and better communication between partners and with the general population. This plan has been reflecting the numbers that we have seen. In less than 40 years, we have arrived percentages very high, higher than 90% for most of the diseases included in them. Now we have to talk about what is going to happen after 2020. And at the end of the 2020, the World Health Organization issued a draft of the 2030 immunization agenda, whose vision includes, and this is quite important, not only for COVID-19, just for all the diseases preventable by vaccination. The first is reduce mortality and morbidity due to vaccine-preventable diseases for all age groups in the life course. And this is very, very important. We are facing a demographical change, and we have to take vaccination in order to respond to this demographical change. Also, decrease the burden of disease by increasing equitable access and acceptance of the use of new and existing vaccines. Third, ensure the good health and well-being of all by strengthening immunization in primary health care and contribute to progress towards universal health coverage and sustainable development. Vaccines are a very valuable input for public health. They have the characteristic of protect collectively the population if a high percentage of the coverage is achieved. They are in a line for the development of countries and are necessary investment for all. Next, please. Based
yes,
on
Sophia,
this,
Sophia, you have 4 more minutes to conclude your presentation.
Okay. In this slide, I want to present just very quickly about what has happened with vaccination in Latin America, but in America, especially Latin America, during the pandemic. We all know that America is one of the regions that has been facing a very problematic situation with 1.22 million deaths, and only 28% of the population has been fully vaccinated. And you can see at the right side the differences between the countries about how many vaccines has been administered per 100 people. We see countries like Uruguay, Cuba, Chile, with very high percentages. But we also have countries like Jamaica, Nicaragua, and Haiti that are facing big problems with vaccination. And the answer is, how can we increase access to vaccines in the least favored countries? The pandemic has shown us that the disease knows no borders, that we all have to face together this. If we take into account, we will conclude that we need a global coverage. Migration is a phenomenon that occurs every day for several reasons, many of them related to conditions of vulnerability. Because of this, we cannot think in isolation. We must understand that we are interconnected, that we need each other, and it is through solidarity with all groups that we will achieve a better well-being for all of us. In the next, please. Because of this, I I just want to say what are the mechanisms by which the countries has been acquiring vaccines, COVID-19 vaccines. The first is supply of vaccines through direct negotiation with the pharmaceutical industry. The second one is the COVAX mechanism, and the third one are the donations. This is the reality. We also have a reality with several vaccines available in all the continent. In the next, please. And if we see these numbers, the numbers of death, the numbers of vaccines available, the coverage of COVID-19 vaccines, we have to analyze what are the links that we can show here involved in vaccination. The first one is research and development. After that, production, approval, distribution, vaccination centers, administration, and pharmacovigilance. All of them are equally important since one of these fails, the chain breaks. First, please. Next, please. Okay, with the first one, research and development. And talking about Latin America, we have to strengthen the pharmaceutical industry with the production of vaccines. A recent report mentions that it is necessary to strengthen the pharmaceutical industry in the region with the production of vaccines, promote the transfer of technology, and they are talking also about the release of patents. This report also points out that the development of vaccines in Latin America is incipient and mentions initiatives in Cuba, Brazil, and Mexico in the development of new vaccines for COVID-19. For their part, Argentina, Colombia, and Chile are in earlier stages. With regard to production, the production of vaccines worldwide is not enough, and we all know that. To meet the demand, many of the Latin American countries have had delays in the delivery of vaccines. Therefore, relying on the current supply does not seem sustainable over time. For that, the development of vaccines should be considered in the medium and long term. In this sense, existing resources must be promoted without affecting the production of other vaccines. We cannot forget the expanded program of immunizations. We cannot forget the other preventable diseases. In relation to approval, the competence and effectiveness of health authorities in the analysis of information related to vaccines is also necessary for their approval. And regarding distribution, analysis of the installed capacity and the logistics necessary to achieve the timely and correct distribution of the vaccines must be given. How are we going to answer each one of these? We have to answer country by country because the reality is different between the countries, especially in Latin America. And in the next slide, we also have the terms related with vaccination centers, administration, and pharmacovigilance. Related to vaccination centers, I have to say that it is important to have the vaccines available, but it is as important as this to have the people vaccinated. Because of that, we have to reach the people, including the vulnerable population, not only due to their clinical conditions. We have to take into account also social, economic, and migratory conditions. It is not possible to think of vaccination campaigns that exclude human rights, ethics, solidarity, and scientific evidence. Because of that, we have to take into account that we need the support of all these stakeholders possible that we can get in the public and the private sectors. In this process, the people are vital to achieve success. Because of that, we need to facilitate access to vaccines, and we also have to promote vaccinations as a daily task. It is important to counter false news and improve perception about vaccination. Today, there is a lot of information related to vaccines. And even so, we have the anti-vaccines groups. Therefore, I make a call and acknowledge that information is necessary, but communication with the patients is essential. A communication based on an active listening and scientific evidence. We need to do that daily. Finally, there is pharmacovigilance. We need a strong pharmacovigilance systems in each country to build a strong evidence-based medicine. In the next, please. So I would like to take again the Immunization Agenda 2030, and I just want to mention the strategic priorities, because we will have to work with this in the next decade. So the first one is immunization programs for primary health care and universal health coverage. The second one is commitment and demand. The third, coverage and equity. Equity is the word that we have to remember from now on. Life course and integration, outbreaks and emergencies, supply and sustainability, and research and innovation. All of these strategic priorities has to be based on the next core principles that are people-focused, country-owned, partnerships-based, and data-guided. By observing these principles, vaccination strategies, vaccination plans must be defined based on the reality of the countries, with the people and their well-being as a central point, and focusing public and private efforts to achieve the goals. And this has been clear now with the pandemic. And I think that we have learned a lot in the last 4 years with the Pan American Health Organization and their initiative, but we still have a lot of work to do. In the next, please. And I know that this presentation can give you only a guide of how to do the things, but I also wanted to bring you an example, because we are pharmacists, and as pharmacists we can do a lot of things. And I just wanted to show you this initiative, which is from Costa Rica, from the Colegio de Farmacéuticos de Costa Rica, our country, in relation to immunization and how pharmacists can act at different levels and establish public and private alliances for a common welfare. The project Pharmaceutical Services Immunization from the Community Pharmacy, contributing to the public health of Costa Rica, has the purpose to integrate and implement systematized activities for pharmacists that allow them to expand immunization services, increasing the population's access to vaccines, and thus contributing to vaccination coverage rates nationwide. And this is one example. This is one example of an alliance between the public and the private sector. And right now we are working with other institutions about the information that we are giving to the people and establishing this communication, which is so important right now. And I just want to conclude because I know that my time is over. And so in the next slide, I have my conclusions. The first one, and I think that is a obvious but always important conclusion, is vaccine development is a great public health achievement. Currently, there is a complex scenario in which the expanded program of immunizations and vaccination against COVID-19 must be, and I repeat, must be addressed in different levels by different stakeholders. Alliances between different stakeholders are necessary, and sustainable and equitable access to vaccines must be guaranteed, especially for those in a vulnerable situation. And here I have to say that FIP is working with these webinars addressing different topics related to vaccination. So this is an example also about the initiatives that we can do in different levels. And the last one, the last slide is just the vision of the Immunization Agenda 2030 and says a world where everyone, everywhere, and at every age fully benefits from vaccines for good health and well-being. And I wanted to conclude with this because I think this phrase has the spirit that have us here, and it is the spirit of the work that we do every day. Thank you very much. Thank you, Eduardo.
Thank you, Sofia. I apologize because we are 1 minute more, and so we of the scheduled time, so we could not have time for the questions. There are two big concerns in the Q&A that are important questions that has been addressed by the speakers. I appreciate and I thanks a lot for the excellent presentation of all the speakers for accepting FIP invitation to participate today. And one of the concerns is in relation to the legal barriers that has been already addressed. And the other is which can be the strategies to improve access in low and middle income countries. There is one specific question that is mainly for Marta. If she can answer, please. How can we join vaccine and immunization advocates? Marta is no longer here with us. And I would like, if Casey or Magali would like to address a final message for our participants.
I think from my point of view, again, there's multiple opportunities for pharmacists to become advocates. Again, I think that what Sofia was talking about, a lot of the work of FIP, WHO, APHA, SHP, there's a lot of organizations that are advocating for pharmacists, the Pan American Health Organization, and in our case, Eduardo, even the Pharmaceutical Forum of the Americas, we have entered into a relationship with the American Pharmacists Association to provide training to pharmacists in the countries of the Americas. So I think there's multiple opportunities for people to do that. One is committing themselves as pharmacists to, work in this area of pharmacy and really put in programs that are patient-centric.
Thank you very much, Magali. Kesey?
Thank you. I'm sorry, was there a question, Eduardo? I didn't
No,
know.
there is no specific, because the questions are very deep and it takes time to answer it around the relation, how to improve the access in low and middle income countries, and the other are the barriers on the legal aspect on relation to performing vaccination by pharmacists. But if you would like to share a final message.
Oh, well, Eduardo, it's always wonderful to see you. Last time I saw you was in Argentina, and thank you, everybody. And to the point, I won't answer long about how to improve global access. I would love it, in the ideal world one day, if we could have these discussions as a global community on these important public health issues, where we know there's going to be challenges like this. And I hope that the world will evolve in such a way in the future. But thank you so much for having me. And on behalf of ASHP and all of us, it's been a pleasure.
Thank you. Sophia, would you like to share your final words?
Yes, I just want to repeat the phrase used by Casey. I hope that someday we could talk as a global community, because with vaccines, vaccines has shown us the importance of collective, of the collectivity, and the importance of public health and all the things that we can do as a health professionals.
Thank you, Sophia. Carlos, please go ahead to close the webinar.
Thank you, Eduardo. Well, I want to thank all our speakers and all the staff of FIP, of FIP that have joined us, and all the participants. Next episode of this series will be the 7th of October, and you can go on with all the information about this kind of webinars in the FIP website. Thank you all for your attention. Here you have the QR code. You can screen, or you can visit events.fip.org or transformingvaccination.fip.org. Thank you.